Lakeside Education Trust, International Pediatric Association of Switzerland, representing 1 million pediatrics across the country. And I have a great pleasure extending invitation for all of you to officially to start this program. I have a great person here who started this center, Diseases and Climate Change, J. Srinivasan, and he's a man of less words and more of action. And he is a person always stand by these academics, try to find some answer for the social cause. And he's a man, he practices what he preaches. In addition to that, now the WHO says you have to, each one of us, you have to reduce your footprint, carbon footprint 2 tons per person. Even though we don't produce, India don't produce that much, 1.3 ton we produce per person per year. And they recommend because other countries to help us out to decrease the global warming. He's done it for 4 tons per person. He's been doing it, double the amount. And also the IPCC report, he has the editor, many of them reports and in relation to the climate change and health for the politicians. And I think, and also he don't really tell that, I like to mention it. He is late Sir C.V. Raman, Nobel laureate, was his uncle. So he's a man with certain values and all this thing. I have a great pleasure extending invitation for him to come over here, officially invite all of you. And because today his other program is there, some of them are going to join a little later, but this will be recorded in the YouTube and it is publicized and it goes all over the world. 150 countries it will go from the Pediatric Association representing 150 countries. Thank you.
Good night to all of you. On behalf of Professor Satish, invite you all for this monthly program that Dr. Paramesh organized for the past almost 3 years on various issues related to health and climate change. And I'm very happy today they invited Dr. Kannan Ramaswamy to talk about hepatitis, which is an endemic condition in this country. And it's important that all of us be aware of it. So I request Dr. Paramesh to introduce the speaker.
Thank you. Without wasting time, I just sensitize the issues before introducing the speaker. World Hepatitis Day is celebrated on the 28th of July in honor of Baruch Bloomberg's birthday, who discovered hepatitis B virus in 1967 and developed a vaccine in the year 1969. Hepatitis B is a preventable, most common serious liver infection spreads by direct contact of infected blood and body fluid. 2 million people have been infected and 300 million people are living with chronic hepatitis infection. 1 million people die each year. Testing is the only way to know for sure if you are infected with hepatitis B. Bloomberg Institute for Research started in 2003. Nearly 30 scientists working on chronic hepatitis, liver cancer in a conducive environment for interaction. In India, chronic hepatitis B infection causes more than half of the death due to cirrhosis of the liver, and it is followed by the alcohol consumption by 20.3% and non-alcoholic fatty liver disease by 12.1%. and chronic hepatitis C 12.7%. During the talk, the author will discuss other causes of hepatitis infection like hepatitis A, C, D, E, and other causes followed by the preventive measures. And regarding the Bloomberg, he was a guest of Indian Institute of Science, 1967. He visited us. He was a guest in our guest house. He himself and his wife had come there. In the Lakeside Hospital, I invited him to talk about it. He spoke about hepatitis B vaccine and all this thing. Then we had a dinner at Holiday Inn was there. Then he said, Parmesh, I want to go to golf club. Then I took him to golf club. Then I asked after dropping back here in the Institute of Science, why you wanted to come to golf club? Parmesh, one of my other Nobel laureate like me, he was a close friend of mine. I want to see what sort of club Bangalore has it. He visited Gulf. I was very happy about it. And also then I said, who it was, sir? He's none other Sir Ronald Ross. He's a Nobel laureate as a malaria parasite he identified. A British foreign-born, Indian-born Nobel laureate. That's what he said. And during that time, he had one word, Parmesh, if the Bangalore people, India people, separate the water control board, sewerage board separately, you can produce liver disease 50%. Other waterborne disease 50%. Because they are all crisscrossed. Because water pipe has to be 24 hours water flow, there is nothing there. Otherwise, there is no water, negative pressure is such causing a lot of problem. I think if you separate the water control board, pollution control separately, you can produce various 50% of the waterborne disease. This I remember what he's saying about it. When I went to 1988 into USA, I met him in Philadelphia. Sir, ladies and gentlemen, to talk about this subject, we have none other than Dr. R. Kannan, MBBS, MD, DNB, DM, FRCP. He did his MBBS in Stanley Medical College and Hospital in Chennai in 1986. Did his MD and DNB in pediatrics and DM in gastroenterology in 1992 in Mumbai. Received a fellowship in Royal College of Physicians UK and a fellowship in gastroenterology. He is the very well known pediatric gastroenterologist in Bangalore. He predominantly practices in Bhagwan Mahavir Jain Hospital and other hospital visits, Meenakshi Hospital, Sagar Hospital and Greenview Medical Center, and has about 32 years of experience in treating hepatitis and other chronic gastrointestinal diseases. He has many awards and scientific papers for his credit and has a special training in retrograde endoscopic cholangiopancreatography. I think the tongue twisting word. Sir, it's a great honor. Without wasting time, I request you to come over and take over. Thank you very much for coming here for our invitation.
So good evening to everybody. Thank you for your invitation, Dr. Paramesh and Dr. Srinivasan, to present about this topic. I was given a topic about measures, how to prevent hepatitis, which is a social concern. So I hope I have been already told that this is for people from different walks of life. So I have decided not to use much of medical jargon. Most of my presentation is in simple English so that you will be able to understand and then carry on the message what I am delivering so that you can be practicing in your day-to-day life. Okay, so the 69th Global Health Assembly, which endorses the global health sector strategy, which is on viral hepatitis. That is what is we have to eliminate viral hepatitis by 2030. That is the goal which the assembly has endorsed. The statistics what I am going to give is mind-boggling. Nearly about 1.5 million deaths happen because of viral hepatitis worldwide. So viral hepatitis can be compared to other communicable diseases like tuberculosis, HIV and malaria. Across the globe, nearly 300 million people are living with chronic hepatitis B and 57.8 million with hepatitis C. Majority of the people, they don't know they have infection, so they don't have any access to go and get tested and get treated. So usually they will go for a chronic condition that is called chronic hepatitis, and their liver get damaged and it becomes cirrhotic. The cirrhosis is nothing but a fibrosed liver. Liver is like a spongy organ. When it becomes like a PVC pipe, then it is called cirrhosis. WHO estimates that 1 in 20 individuals suffer from chronic hepatitis in India. So this is a liver-related death. So you see the Southeast Asia, 62.6% of the global death happen in this region. Nearly 54.3% of the global death is due to cirrhosis, out of which 50% is more than hepatitis B infection and 15% due to HCV infection, that is hepatitis C, and non-alcoholic fatty liver is about 12% and alcohol consumption is about 13.3%. If you look at our neighboring country, look at this here. See, our India is in the intermediate zone. Look at our neighboring country, Pakistan, which is in the less prevalent, that is in the green color. So basically it is not Pakistan is far advanced because being a Muslim country, they don't have access to alcohol. So the alcohol predominant hepatitis is killing our brethren, our brothers and sisters more in India. So nearly about 3/4 of the global death is happening in this region, Southeast Asia, and 2/3 of the global burden due to acute viral hepatitis occurring in this region. What is hepatitis? Hepatitis is the inflammation of the liver. Hepa means liver, itis means inflammation. If you go to a doctor, we always say you have conjunctivitis, you have tonsillitis, you have appendicitis. That means it's the inflammation. So that is the thing we call it as liver is getting inflamed. It is called hepatitis. So what is inflammation? Inflammation is your body process of fighting against things that can harm it, such as it could be infection like bacteria, virus, fungus, or your COVID virus, or injuries. It could be anything like your ischemia, toxins. That is, I always say toxins is this could be alcohol or it could be drugs. So when the response from your immune system that triggers something, your body releases chemicals. It could be your interleukins or your free oxygen radicals that can damage your cells. That's the way our liver gets damaged. So what causes hepatitis is infection, viral infection majority like A, B, C, D, E. Alcohol in India, alcohol is a thing is coming up. So usually we say we are in a developing country, only infection is the main thing. Now the demography is changing. So alcohol is the second largest killing factor for the liver. Obesity, this is also a next thing is coming up. So we are not far behind. We are getting all the bad things from the Western countries and we are getting all these problems. Toxins like poisons, chemicals, herbal medicines like complementary alternative medicines can cause drug-induced liver injury. Rest of things are very rare like genetic problems and autoimmune disease. That is not going to be part of the talk today. So I just restrict my talk to what is happening in India. What is the thing is happening in our country? What are all the studies we have done? This is a multi-center study where the thing is the centers spanning from north to south, east to west. It is conducted as a multi-center study conducted over about 3 years. The study group is newly diagnosed liver disease. Nearly about 13,000 patients who have been diagnosed with liver disease, out of which nearly 1/3 are already diagnosed with cirrhosis, so cirrhotic liver disease. Non-cirrhotic liver disease is 62%. Patients who are diagnosed with cancer is 3% at the time of presentation. What is the etiology? Just like whatever we have said, the etiology is about in India still 43% is due to hepatitis B and C. Alcohol is a very strangely, it's about 31%, 1/3 of our population who are presented us with hepatitis due to alcohol. The remaining 24% is due to obesity, fatty liver. That is the thing we have to worry. So this is the cause of cirrhosis related death in Southeast Asia. I just wanted you guys just to focus on India. In India, nearly about 65 to 70% is due to infection, whereas the remaining major chunk, about 20-23% is due to alcohol. The rest of the things are all filling up, about nearly 10 to 15% is due to your fatty liver. So regarding the infection, this is a meta-analysis. It is published recently from Journal of Education Health Promotion from Chennai. What did the study is? The study is about, they have selected about 28 studies. Over a period of 2 decades, what are the publications happened regarding hepatitis B? And they collected only 9 studies, which includes all the hepatitis viruses. The prevalence is hepatitis A is up to 52.5%, hepatitis B from 0.87 to 26.6% because the different studies they included. What I wanted you to concentrate here is the hepatitis E virus is the leading cause of acute liver cell failure that is spread by contaminated food and water. Sexual behavior, that is men to men sex, there is a gay sex. Childhood transmission, that is vertical transmission for the mother to the child, using reusable syringes, using reusable blades, particularly in the rural population. They go to a common barber shop. They don't change the blade. They don't sterilize. That's the way rural people get hepatitis B infection. During blood transfusion, previous history of hepatitis B, all these things are risk factors for hepatitis B. Multiple blood transfusion and tattooing. We get inspiration by seeing Virat Kohli. We get inspiration by seeing, Messi. These are all the sports icons. But they all go to a good center where they use a reusable needle. The common people, they go and get tattooing using a used needles and they get the infection. The prevalence of hepatitis B was higher before the implementation of HPV vaccination. HPV vaccination is, if you have kids, they have given, nowadays we are giving at birth. The 0 dose is given at birth. This is because of the policy change, and lot of we put a pressure, the pediatric body put the pressure, and the government included, like the way we wanted to other vaccination also to take up. So first I will talk very briefly about hepatitis A. It's an acute disease, self-limiting disease. Chronic disease doesn't happen. Usually associated with the fecal-oral route, open air defecation. Even though Swachh Bharat scheme is happening, but it is not. We know that it is not happening in 100% thing. So that's the way the flies and the fomites through the food we get the infection associated with the poor sanitary condition and a lack of safe drinking water. So India is hyper-endemic for HIV infection, and usually it is prevalent in children, and they don't present with the jaundice. Jaundice is a late manifestation of hepatitis. Please understand, before jaundice appears, we get a lot of other clinical symptoms that I don't want to elaborate now because of want of time. In India, what we are finding is nearly about 20-25 years ago, the hepatitis A is predominantly a disease of children, infants and children. Usually they have an anecdotic hepatitis. That means they don't have jaundice. Now we see a lot of improved socioeconomic conditions and hygiene. We shifted the Indian prevalence from high endemicities to the high and intermediate endemicity. Particularly in India, it is still not happening. It is not happened. It is happening. There is a paradoxical shift, and contracted disease is shifted to the young adults and middle age group because they are not exposed in the younger age group. So these people, young adults and middle age group, they contract the infection. Once they contract the infection, young adults, the disease pattern is very severe. They can go for acute liver cell failure. They can go for hepatic coma. So the number of people who needs hospitalization and more numbers needed transplantation also we are encountering. So the seroprevalence rate is about now only 50 to 60%. Before it was in the young newborns, when we take a blood from the newborn, because the mother is having protective antibody, the babies also will be showing the seropositivity for the hepatitis A virus. Now we are encountered only about 50 to 60% is positive. 15 years ago, it's about 100%. That means that majority of the pregnant ladies or the childbearing females, they're not exposed to the virus when they are young. That means that their water drinking pattern or their sanitary condition is better. So this age group of maximum exposure to HIV infection, that is the newborns at the age 6 months to 2 years, is shifted to the older children and young adults. So how to prevent hepatitis B? As we talked since the time of independence, the thing is we have to improve the sanitary conditions. We have to provide safe, clean drinking water, adequate sewage disposal, proper hand hygiene. All these things we are keep on preaching, and then it is carried out in some part of the world, some part of India, not throughout. Vaccination, it is available. It's an inactivated vaccine. IAP, that is Indian Academy of Pediatrics, recommend 2 doses. That is only available for the private healthcare. Government is not giving the HIV vaccination. The reason I will tell you in the next slides. Usually is given for 2 doses. The universal vaccine usage is not recommended, and it is still under debate. If you see why universal HIV vaccination in India is, are we ready? This is the world map where you see high endemicity. That means 90% of the population are exposed to the hepatitis virus. Therefore, they are immune by the age of 10 years. That is the thing, the red one. India is still in 1990, after 15 years, it is high endemicity. In 2015 also, this is your AI model, mathematics projected model. Still, we are in the hyperendemicity zone. And if it is intermediate seroprevalence, that is 50% of the population, they are positive for about the HIV antibodies by 15 years, and 50% by 30 years. That is all the developed countries like North America and European countries, Australia and that. So in Argentina, they they experimented a novel method, because Argentina, if you see, they are in 1990 they are hyperendemic. By 2050 they are in the intermediate seroprevalence zone. So what they did is they give just one dose rather than 2 doses, and then at 12 months of age, which reduces the symptomatic hepatitis, fulminant hepatitis, and number of transplant requirements. So what they calculated is what is the amount, that is the dollars needed for the vaccinating the whole children pediatric age group, and they calculated the cost, and then how it is far less than the people who requires the hospital care for this symptomatic hepatitis, liver transplant, liver failure, all those things, they significantly reduced. India, why government is still not recommending the vaccination is because we still in the hyperendemic zone. So it is better to have a safe drinking water, have a proper sewage disposal and toilet for everybody. Then we can, if you reach this stage, from this stage to this stage, then the vaccine can be administered. That is the thing all the epidemiologists are advising. Hepatitis E, more or less the same. It is a non-enveloped virus. India is hyperendemic for HIV infection. It is again transmitted to the fecally contaminated water. What happens is, if there is no vaccine, if the pregnant ladies contract the virus, usually they land up in abortion or premature delivery, and they can go for ladies can go for acute liver cell failure, and there is increase in the maternal mortality. How do you prevent as any waterborne infection? If you are in the high endemic, high risk area, use boiled water or even for brushing your teeth, and use purified water for washing vegetables. Even while you are peeling it, you have to use boiled vegetables, and avoid raw meat. Wash your hands frequently. That is important. And particularly food handlers and those people who are always they are taking the major part of the kitchen cooking like this one, they have to wash their hands with hands frequently and boil water, purify it and drink it. So it is HIV vaccine available in China, but it is not available worldwide. So it is not in widespread use. It's a self-limiting disease. Only certain group of people, they get the severe disease, and we have to use symptomatic treatment. There is no specific treatment for this. Hepatitis B, on a global scale, HBV carrier status in India is of intermediate endemicity, that is 2 to 4. What does it mean is, if you go to MG Road, ask 100 people to come, they don't have any problem. If you do the serology, 2 to 4%, that is at least 2 or 4 people will be positive. That's the thing it states. It contributes to the second largest carrier pool in the world. 50 million Indians are having this virus, and 80% of the liver cancer is due to virus-related liver disease. In India alone, approximately half of the liver cancer is due to hepatitis B. Horizontal transmission, that is a person transmission, is more common in India compared to the vertical transmission. Vertical transmission means from the mother to the child. Genotype A and D are more common, and hepatitis B vaccination has been introduced as a part of the childhood immunization. That is birth dose. Usually, zero polio we give. So like at birth itself we give hepatitis B vaccine to prevent the children from getting this disease. How do they get it? When you are injecting IV drug use. hemodialysis patient. They frequently come for the dialysis. And like us, doctors, nurses, ward boys, who are healthcare and public safety workers who are frequently in contact with the blood and blood products. People having HBV infected partner, that is a sexual transmission. This is the men who have sex with men. And those who are living in the same household also with the infected person also have a chance of having the infection. So it's better to screen them and immunize them. So it's a vaccine preventable disease, hepatitis B. So all the sexual partners, family and household should be tested and vaccinated. What we are facing, why it is difficult to eliminate hepatitis B, despite, we have introduced the vaccine in 2000 or 2002, it's a compulsory and zero dose vaccine is introduced and then it is formulated, it is carried out, but still we have some hassles. What are the problem in preventing hepatitis B is we have limited availability. There is no data, okay, reliable national data, state epidemiological data for carrying out any strategies or policies. There is still population of hyperendemicity in tribal areas, particularly in Andaman, Nicobar and the northeastern states. The prevalence rate is as high as about 57%. There is low level of awareness among the healthcare workers itself and patients and public also regarding the disease, how it is spread, what are the risk factors and complications. So here we need a lot of public education is needed. And low immunization coverage. Not everybody is getting vaccinated. The recent analysis or this one about hepatitis B vaccination, only 46% of the infants born in India are getting the zero dose hepatitis B vaccination. Remaining 54, they didn't get the vaccine. There is still a lot of stigma. There is inadequate screening of transfused blood. There are a lot of ways we can screen. The cord blood test is a lot of false negative and false positive. The enzyme immunoassay, that is ELISA test, is not widely available, and there is low access to the preventive and testing service. That's the reason people who have been diagnosed, we get a lot of patients who are going for a pre-employment screening. They are positive and they are very shy of accepting and come for regular follow-up. So these are all the things we have to break through. The pillars of HBV elimination is one, immunization. Other one is we have to prevent the mother to child transmission. So always antenatal checkup includes hepatitis B virus. And if it is positive, we have to take adequate, action. Safety, blood banking. That is blood banking. Usually we have a recall program and we have to, from 2002 Supreme Court order, none of the blood tested, which for hepatitis B and hepatitis C and HIV are given for donation. They not be released. Otherwise, it will be. It is a medical legal issue if you are not testing and then giving it to the patients. Safe dialysis, safe injection practices. Many of you, if you go to the primary health center, I do not know, still they have the glass syringes. It has happened nearly about 25 years ago. Now still they are using or not, I don't know. The biomedical waste disposal also should be adequately addressed. Harm reduction strategy is we have to educate the people who are using IV drug. They have to use disposable needles. They need a de-addiction. And if they are getting morphine or pethidine addiction, they have to have a program to substitute. And expanding the access. It is a uniform healthcare access should be promoted and it should be advertised. Then only we can able to reduce the HBV, that is hepatitis B virus infection also. Next is hepatitis C. More or less hepatitis C will follows the same pattern as hepatitis B. It will be followed through the intravenous drug abuse. Sexual transmission is about 15%. Transfusion is a blood transfusion. Now it is getting reduced, but these are all the things is not reduced. And other perinatal mother to child transmission is about 5%. Sharing injectable need drugs, unprotected sex, needle stick injury, mother to child transmission. These are all the main causes for hepatitis C. So how to prevent? You wash the hands. You wash your hands. We cannot put gloves for each and every patient. So whenever we are examining a patient or when you come in contact with the patient, we have to wash it. There is no vaccine for hepatitis C. We have to protect ourselves by using all these things. You use condoms with sexual partners, avoid direct contact with the blood and body fluids, cover all cuts carefully, avoid sharing sharp items like razors, nail clippers, is particularly ladies. If you go for a manicure or a pedicure, you do not know who they have used the same instrument for the previous customers. So you have to be careful. We go for this one, discard sanitary napkins, avoid illegal street drugs, use sterile needles. You demand whenever you are going for any injection or the doctor is giving, you ask for a disposable needle and the syringes. And tattoo I have told already. This is again, if you see the liver related death in India, nearly about 62% of it is due to hepatitis B and C. The remaining is due to alcohol. That's the thing we have to worry. The alcohol is the main killer next to viruses. So the magnitude of alcoholic liver disease, nearly 22% of all deaths of cirrhosis and death due to cirrhosis and other chronic liver disease due to alcohol. Global Health Estimate data set states that 20% of the liver cancer is due to alcohol. We are wondering, of all the death due to alcohol related cirrhosis, 20% of the death is estimated happened in India. This is despite our Indian population is only account for 17.8% of the global population, and only 72.3% of the people aged less than 15 years. We presume that less than 15 years don't drink. In our Indian men and women, they don't drink. And it has a very high proportion of lifetime alcohol abstainers. Despite all these things, our alcohol related death is about 20%. So number of deaths due to alcohol related issues, is increased 22%. That is from 47,000 to 57,000. This is an approximate estimate because the prevalence what we are getting, the thing is, it is whatever we are getting is the tip of the iceberg. The reason why India we are having alcohol related liver disease is more because the rising mean income, which leads to increased per capita of alcohol consumption. And annual per capita consumption of pure alcohol in current drinker aged more than 15 years is 14.6 liters. The prevalence of episodic drinking in 2015 is about 44%. So what is the pure alcohol is the content is more important. If you see, according to the North American standard, one standard drink should contain about 0.6 ounce or 14 gram of alcohol. If you look at the wine has about 12%. Fortified wine is about 20%. So 20% means approximately it should be about 3 ounces should have about 28 grams. The malt liquor, that is typical of a regular beer, is about 5 to 7%. Whereas your whiskey and rum, all those things, about 40% alcohol. So what they say is population-based survey, they say that men should drink at least 40 to 80 grams of alcohol daily. And women should drink at least 20 to 40 grams of alcohol daily for 10 to 12 years to achieve a significant risk of liver disease. Is it true? No. So when it is, what is happening is we see binge drinkers. They come with about only 6 months or 12 months of severe drinking. They come with acute severe alcoholic hepatitis. So the National Institute of Alcohol Abuse and Alcoholism states that the average consumption of more than 3 drinks, that is 40 grams per day for a woman, and 4 drinks, that is approximately 60 grams per men, considered to be a minimum threshold for the diagnosis of alcoholic severe hepatitis. And they need not drink for 10 years. The heavy alcohol ingestion should have occurred more than 6 months, and there should be a minimum of, there should not be more than 2 months of abstinence. Then we can consider this is the alcohol is a culprit. The alcoholic liver disease, 100% they develop alcoholic fatty liver. Okay, nobody is excused. But the alcoholic severe hepatitis, the incidence in India is not known. 8 to 20%, 1/5 of this alcoholic severe hepatitis, they develop cirrhosis. 3 to 7% of the alcoholic severe hepatitis develop cirrhosis. Cirrhosis, as I said, it's a fibrosed liver, scarred liver. And 40%, it is irreversible. You cannot turn back. You cannot become a normal liver, normal patient. 40% of that can develop severe alcoholic hepatitis, and can present with acute and chronic liver failure. Okay, 2% of the alcoholic cirrhosis can develop liver cancer. So this is the article, just as a lighter vein. I wanted you to, this is taken up from Hindu. In the central page, it was published on 5th of July. Moderate alcohol consumption has no health benefits. We see a lot of in the social media, in Facebooks and this one, WhatsApp. If you drink red wine, it protects your heart. That's the thing. People will be, very happily they drink. This is that is a thing studied by a American biologist. His name is this one, Philip Raphael. He did a study on a case series basis, and he found that he did a J-shaped curve. So to the right of the J and the left of the J, the extreme, those who drink extreme alcohol on the top, that is a long end of the J, and those who are having less alcohol and the short end of the J. Both the extremes, they don't live enough. They have a heart problem. Those on the loop of the U loop of the J, they're taking moderate alcohol consumption, so they lived longer. So that is proved to be wrong. So what I wanted you to stress this one is they have the moderate alcohol consumption lead to reduction in damage to the tiny blood vessels called microvascular disease that only responsible for your heart attack. It is published in Cardiovascular Diabetology. What they disputed the claim that moderate drinks benefited the heart health because of these individuals had other healthy lifestyles. They regularly run, they regularly do exercise, they eat healthy foods. That is the reason their heart has been benefited rather than the alcohol per se. If you exclude these people from in the study, then alcohol found to be harming. So people with the moderate alcohol use gained one whole year that was erased by 2 to 4-fold increase in the head and neck cancer. If you are taking alcohol regularly, you are known to get to this pharyngeal cancer, laryngeal cancer, all these things. So strictly say no to alcohol. 50 to 20 minutes of moderate physical activity every day leads to reduced mortality as seen with moderate alcohol use. How do you prevent alcoholic hepatitis? You can, based on some yardsticks, and with this yardstick, that is they have collecting the database from the primary health center level, from the primary health level. You can take some denominators and then you can have this data and then present to the government. What is the alcohol policy in India? We have a regulation. The alcohol is the state list. It is not with the central list. So we have a national policy which is state specific. Some states like Gujarat, Manipur and Bihar, their alcohol is prohibited, but majority of the states, they permit alcohol. We have a regulation regarding minimal legal age for sale, excise tax is there, legal blood level, alcohol while drinking is all these things there. But we don't have a written policy on action plan. If suppose many people have the disease, what the government can do? We don't have a government support on community action plan. We don't have any legally binding action on sales promotion, product placement, sponsorship. We don't have anything. So in these areas, we have to put pressure, the policymakers have to put pressure so that the alcohol drinking can be reduced. Regarding metabolic liver disease, again, is this another, it is a volcano or it is a epidemic is going to happen. Ultrasound based screening in the urban areas, nearly 1/3 of the population is having fatty liver. Probably if any of you have gone for a health checkup, master health checkup, you will not be surprised, if you don't have a fatty liver in your ultrasound report. In the rural areas, it was low. Now there is in 2010, within a 6 years period, the rural area also is catching up with their counterparts, urban counterparts. Obesity, diabetes, lack of physical activity, all are found to be high risk factors. If you are having a body mass index which is high, that is the one contributing factor to develop fatty liver. You don't need to drink alcohol. Your fat is going to kill you. What is the natural history? If you look at the thing, the fat accumulates in the liver, then the fat oxes, it causes mitochondrial oxidation and it damages your hepatocytes. That is happens within about 7 to 8 years. Then nearly 25%, one third of them, they develop cirrhosis within a span of about 1 decade. Once they develop cirrhosis, as I said, it's a scarred liver, fibrosed liver, it will go for decompensation. At this stage, the patient can get hepatitis A, hepatitis C, and they can go for decompensation, and they can and then they can perish. Lean NASH, just I wanted to think only fatty people or only the people who are overweight only need not develop the alcoholic, that is non-alcoholic steatohepatitis or fatty liver. Even NFL is also documented or seen in non-obese individuals. That is, in particularly Asians, we have a predominantly our fat will be accumulated in the trunk. We have a not an apple-shaped obesity, we have a pear-shaped obesity. So we have a tendency to accumulate fat over our abdomen, our waist. So in Asiatic subjects, those who have a normal BMI and they have a high total body fat, they don't have a muscles. If we compare the same weight with the Western Caucasians or this one, North Europeans, we have a total body fat, visceral fat is more, which is more accurate, have a tendency to accumulate in the truncal area. So these are the people who have a high chance of developing insulin resistance and diabetes. This is a study, very quickly I will say, this is a study done in Asian Institute of Gastroenterology in Hyderabad. So what they did is they compared what are all the risk factors to develop regarding the nutritional risk factors and other risk factors. Whereas the people with have a fatty liver, they have a high value of body mass index, they have a high waist circumference, they have a high percentage of body fat, they have a lipid profile is abnormal, and they have high blood pressure. The total caloric intake, we eat more, okay, and that more our diet is more on the carbohydrate, high carbs and high fat, which is the predisposing factor or culprit for the fatty liver. The three parameters, one is body mass index, waist circumference, and percentage of dietary fat index are independent risk factors for developing fatty liver. Is it happens only in adults? No, it happens in children also. Cross-sectional study, this is study done in Delhi by All India Institute of Medical Sciences. Here they have collected the children who come for other OPD services. Out of 218 children, 52 are overweight, 166 are obese, and the ultrasound shows fatty liver in 62%. They have a high transaminases, the ALT, liver enzyme is high in nearly about 3/4 of the patient. And they have a high body mass index, body fat, waist circumference, everything. And treatment, there is no medicine. You have to sweat out. So you have to do exercise, you have to do dieting, you have to do the weight loss. The exercise is, as per the WHO recommendation, moderate exercise program at least for 5 times a week, 3 or more days of weight training, or 150 minutes or 300 minutes in a week of intense aerobic activity. These are all the things can reduce the chance of you developing, not developing steatohepatitis. Diet, hypocaloric diet, if you are obese, your weight circumference more, avoiding fructose. Okay, that is important. Nowadays, people will be very become food fad and they drink juices. I drink only orange juice. I drink only apple juice. The fructose is a culprit. Trans fat present in the soft drinks, all our junk foods. Their trans fat more than 10% is there that can kill your liver. So measures to prevent fatty liver is our national policy to be revamped. There is no, we have a national program for prevention and control of diabetes, cardiovascular disease and stroke, but there is no program for obesity and fatty liver. Physical activity to be encouraged in the school. If you look at our Bangalore schools, majority of the schools, they lost their playground. The building after building comes and people starting going to JE training or NEET training from 5th or 6th standard onwards. I do not know what is going to happen after 10 or 20 years. Junk food consumption should be curtailed. Kerala, for example, they implemented fat tax. If your trans fat is more than 10%, they have implemented the fat tax. And trans fat should be less than 10% in any packeted foods or processed foods. Even though Food Standard and Safety Association of India, they recommend it, they are not implemented as a law. The last and not the least is a drug-induced liver injury. If you see any of your friends or relatives who have a jaundice, immediately they go to a complementary and alternative medicine. The complementary alternative medicine is the commonest drug documented in the drug-induced liver disease. Incidentally, this is a study happened in St. John's Medical College by Devar Bagi. Out of 128 cases, he's documented that is complementary alternative medicine was implicated only in 2 cases. But his denominator is different. He has taken only people who come with acute liver cell failure. Ayush system of medicine, that is a traditional medicine. Ayurveda, Yoga, Naturopathy, Unani, Siddha, and homeopathy are commonly in India were implicated in drug-induced liver disease. What is the factor which facilitates the CAM health-seeking behavior? Because the false belief of safety drug profile. Because they are coming from herbs, they don't have any side effects. Cheaper treatment cost, rampant advertisement. If you look at any of the auto, you wanted to reduce fat, you wanted to reduce weight, use Herbalife products. Okay, all these gimmicks, which rapidly spread. So these are all the things like I wanted to just say Gilai. I did not know during the COVID lockdown or COVID epidemic how many of you used. The Gilai is called Amritavalli in Kannada, Amritavalli in Tamil, or in Malayalam also is called Amritavalli. This is taken as an immune booster. It is known to cause havoc. It can cause acute hepatitis. The injury severity varies from asymptomatic acute liver cell failure. Many products are used to reduce stress, used as antioxidants, anti-inflammatory agents for weight loss or sexual enhancement in men. So all herbal products are not subjected to drug regulation as it come under the food supplementary list. It is called as a supplement, not a drug. So the content and concentration quality are not guaranteed. So this is, you must have seen green tea extract, Herbalife products, oxalate used for weight loss, acute liver cell failure requiring transplantation requires about 50% of the cases. Anabolic steroids, if you go to gym, the gym trainers will be inadvertently, they will be telling this is the, you can build muscles quickly and then you can use these medicines. These are all the medicines cause cholestatic jaundice, hypogonadism, heart attacks, psychiatric disorders, etc. This is the one thing I just wanted to stress. This is the outcome of toxicology of herbal drugs in alcoholic hepatitis. It is from Cochin study. If they develop patients who develop alcoholic hepatitis and they have retrieved the medications, that is the complementary and alternative medication, and sent for analysis. You see what are all the things added into the complementary medicine: antibiotics, NSAIDs, antidepressants, chemotherapeutic agents, diuretics, poisons, heavy metals, herbicide, insecticide, all these things were there. And here just I wanted to see, they have people who are used herbal medicines, people who are not used herbal medicines, they followed up. People who used herbal medicines, if you see, the 30-day survival is only 37% as compared to 83% who are not used herbal medicines. 180 days, 6 months survival is only 18%. If you look here, it's about 50%. Half of the people, they survived without using without getting poisoned by the herbal medicines. So the take-home message is enterally transmittable viral hepatitis, A and E. We have to have access to safe drinking water with improved sanitation. Whereas parentally transmittable viral hepatitis like B and C, you need a vaccination program, availability of screening tests for blood and tissues, donor recall program, safe injection practice, sexual practice are the few harm reduction measures to control this infection. Alcoholic hepatitis prevention, de-addiction not only involves the medical fraternity like us and policymakers, but also the government responsibility is more. Individual, they have to take up their responsibility and not to indulge in alcohol drinking. Again, the daily hepatitis, the CAM, that is an alternative medicine, is going to stay. Okay, only thing is we have to educate the public, and then we have to tell them what is a safe seeking behavior in camp. As far as the policymakers or the government should put a this one law or the regulations. All the Ayurvedic or the homeopathic medications, if you see, the content will not be printed out. The product label should be there in each and every one of the prescriptions, whether it's a proprietary medicine or non-proprietary medicine, it should be included, but it is not happening. And there, if it is there happen, then we can integrate our allopathic medicine with the CAM medicine so that it can help the public. NASH prevention, as I said, you catch them early. You catch them when they're in the study, when they're studying in the high school or in the PUC. You screen the adolescents, young adults, encourage physical activity. We need a strict regulation of food sectors, bringing them under the food and health safety umbrella to make a vibrant nation. Thus, I conclude, prevention of hepatitis in India is a lot done, but yet more required. Thank you.
Dr. Kannan, thank you very much. They were wonderful talk and the practical hints what you given how to prevent it. There is no cure indeed. And now the question and answer session will end afterwards. We have a photo and we'll do that. One of the topics we cancel it today because of the time factor. And any questions, sir?
Alcohol and malnutrition go together?
Alcohol and malnutrition not go together. Sir, the later part of the thing, if they have severe hepatitis and they are restricting their intake, okay, usually binge drinkers and people who are coming from low socioeconomic status, then they will go for it. But we have a lot of our IT guys who are very rich, they also have alcohol. They are obese. They have obesity and the alcohol. If it 1 + 1 becomes 2, and they will come there.
Obesity alone can do it also.
Obesity is because of the non-alcoholic activity.
Thank you, sir, for the wonderful talk. I just have a small question. You mentioned that hepatitis A and E are transmitted through contaminated food and water. You also said that infants have it. Is it transmitted in vitro during pregnancy, or how do the infants actually have hepatitis A and E?
That is through the mother and the food handlers, the caretakers, like the grandparents or this one, they will be having suffering or they have, and they will be through them the children will contact them.
Even after infant can get it
Yeah, 6 months or baby also can have. So that is not only the food handlers, we don't, the majority of the time they don't have a right of course distilled water. We get it from the tank water. Okay, they prefer the eating food from the tank water. The tank water is not a virus. They open purification and they use the common bathroom and the common water facility through the food tank. That's the reason we get epidemics. That's the reason we get in particular few years in particular geographic locality, so many people will get hepatitis A, hepatitis E, that's the reason. So through the water and food handlers and the business, the water only we get. That's the reason I told in hepatitis B, when in a high risk area, endemic area, even if you are brushing the teeth, we use a boiled water. Let us say, we cannot ask everybody to get this one.
You mentioned that people in the higher income group are the ones who are more exposed to alcohol drinking and probably the susceptibility to the alcohol. What about the lower income group who probably drink alcohol and not the...
What the answer I mentioned is not high income. The high income people, they drink high quality alcohol. But the thing is, their nutrition is good. Whereas the low income people, whatever even if they earn 200 rupees, the 200 rupees will be given for the alcohol shop. They don't eat. So malnutrition, that's why they get the malnutrition. So the malnutrition and they get superadenine, and they will decompensate. Arak and this one is yes, the alcohol content will be vary, but depending upon how much they distill it. It's not a, we don't have a standard thing to have this much of alcohol. How much the local people distribute, that much alcohol they will get. That's the reason we get all this alcohol,
Any other questions? Yes, ma'am.
It should be taken as a food supplement, not as a drug. Like you mentioned it, like I shouldn't. It's like I can drink as a aloe vera juice, but I can't take it as a supplement. Is that right?
Aloe vera juice you can take, but
Like
it's not cumulative toxicity. Okay. So the thing is, every day you drink aloe vera juice, which is concentrated. Okay, that can cause. But we don't, juice you take it once in a while, once in 3 days, once in 2 days. But the thing is, the drug contains more high concentration of the aloe vera plant. It contains alkaloids. The alkaloids, plant alkaloids don't cause liver disease.
I can make in my own home, and it won't cause a need cause a.
No, if you take, that is the concentration what you are taking is more important.
By adding the things
The
in
cost, yeah, the dilution, if it is diluted, I don't think it causes problem. But the drugs, what they are making is more concentrated. So they heat and they will give concentrated the amount of aloe vera extra which is there. That if you are taking regularly, the cumulative toxicity will cause it.
Another question is a formation for fructose in them. So after in every fruit will have fructose.
Yeah. The thing is, if you see the apple is a natural thing, but if you see our artificial sweeteners, like they have cornstarch syrup or fructose syrup, they don't make concentrate. The fructose, what happens is, it makes your stomach, liver, to accumulate more fat. The carbohydrate can convert it into fat. Okay, so that is it. Here, if you eat one apple, the apple has, say for example, it is only about 15 grams of fructose. The same thing if you take any artificial drinks, say for example, it is Fanta or Miranda, the fructose content, the concentrate itself will be much more. It may be equal to about to eating 4 or 5 apples. That is the thing we are telling.
I think in adding to that one, some of the studies have been in South American countries where they're taking the fructose containing a lot of drinks. People working in the sugarcane field, they had along with the liver, the kidney disease. Highest, 30% of them end up with the kidney disease damage. The same thing is the fructose containing drinks and all those things. That's what it is. And also there are some group telling that the rectified spirit in India is made into various alcohol, with adding some flavor and all those things. Usually the other whiskies is made from the barley and all these things. There is a difference in that. Single malt, what they call. Is there any difference you can claim in that? But as alcohol content is the same. 40% alcohol, 80% proof. And wine is 10 to 12% it comes there. And buttermilk has got 2 to 3%. Beer has got 4% alcohol content. So in that one, moderate, you said that's fine. But some people claim you can have the single malt, one plague every hour for 24 hours, liver will metabolize, getting used to it. I know, I saw that one. That's what some of the people coming from the gastroenterologist, he did mention slowly, if you drink that one, nothing will happen.
No.
That was earlier. Yes.
You having adequate nutrition and your regular workout.
Workout. Yes, that is workout he did mention about. Yes. Yes. Okay. Any other questions? If you're not there, thank you very much. Wonderful way you spoke about it. Before we give the vote of thanks, we have a small token of appreciation. I request Professor Srinivasan to hand over to you, sir. Yeah, I request.
On On behalf of Divecha Center for Climate Change, I would like to thank Dr. R. Kannan for his talk. Thank you, sir. It's an honor to have you here. And thank you, participants, for joining us for the session. If you can kindly join us for the photo session.